Dr. Marco. Welcome to this week's health tip. So today we're going to be talking about chicken legs. So one of my clients was on the table and I was doing my network analysis and I was opening and closing her legs and things like that, and she kind of goes, you know what are you doing? You're checking for if the chicken legs are done cooking? And I thought, man, that's a good analogy. I'll use that in a health tip. So what are we doing? So I've had other health tips describing the technique, like why do I only touch one side? Maybe you heard on the left side, but I'm only touching your right leg. I've described that in other videos. So with this one here, I'm just going to describe the concept of the tension in your system. So you're boiling the chicken legs in the stew or whatever, and they're kind of firm and rigid like that. But then after they start to boil and kind of go through the cooking process, they become softer and they'll be more malleable and kind of flexible. So that sort of rigidness of the rigor mortis or whatever you want to call it goes out, and as it's boiled they get softer and more malleable, and so it's easier to open and close the chicken leg sort of thing. So when somebody's on the table and we're doing the network care, one of the things is we're always looking at your heels, right? We're looking, checking the tension in the heels and things like that. If you've ever seen somebody that's had like a brain injury or something like that, you can see that one side of their body is really contracted and it's all kind of firm and rigid, and it's really hard to move because certain sides of the brain aren't sending down these inhibitory messages. So that's not what we're dealing with. We're not dealing with a brain injury, but we're just talking about when there's tension in the system and the messages of relaxation or inhibition, we call it, from the brain are not getting to these tissues. The wrist might be a little harder it might not be as free, and the heels are a big indicator of tension in your spine and your nerve system. So that's why we use your heels. And the legs, is it easy to open and close the legs without resistance? I should be able to put my hands between your heels and just do that, and they should just kind of fly open. But if I'm doing that and I'm kind of finding resistance, or it's difficult to move, it's hard to push them together or open them apart, they just tell us different patterns of tension that can be in your system. Are you kind of flex forward like this? It's kind of hard to open your legs. Or are you kind of twisted like this? It's kind of hard to push your legs together. So when we do our network contacts, we're doing the light touches, sending a signal to your brain to pay attention to the spine. And when the brain becomes aware that, oh, these patterns are off, or I'm holding a lot of tension here, it'll naturally kind of do self-corrective behaviors, either breathing or repositioning movements, or breath kind of comes in, or your body just kind of understands the patterns and it says, okay, I need to relax these muscles, let this go, and your breathing might improve, you get relaxation, and then we'll notice that as we go through the visit that the legs get easier to move and easier to open and close. And when I get certain I call them outcomes in a visit, like let's say it's really hard to turn down your heel and I do a few contacts and then all of a sudden it becomes really easy, then I know your brain was able to connect with that pattern, release something, and it learned how to do something constructive for your body in that visit. So then I know that you're kind of quote-unquote cooked for the day, and your chicken legs are done, and that's how I know you can go off on your way and you come back next day and learn something else. So that's kind of like just one of the indicators that we use for checking tension in your system and seeing when you're cooked or not. So I thought that was an interesting little tidbit that my patient said. I thought it would be kind of a funny health tip, so that's kind of one of the things we look at. So hopefully that was helpful for you in care. And for those of you who don't understand network care, it's the light touch chiropractic technique that we do that helps your body kind of discover its own tension patterns and helps it to learn strategies to release them or use its own built-up tension to do constructive work. So that's your health tip for this week. Hopefully that was helpful, and please share it, and we'll see you next time.